At this time, I will talk about fat injection. Fat injection is a type of surgery used to add volume to areas of the face or body that lacks volume. This surgery is a very important surgery that cannot be left out for among modern people. Compared to fillers, it is less expensive, and because a person's own tissues are used, there are no allergic reactions. Furthermore, there is a plentiful amount in the body. Because it is not a foreign substance, patients can easily receive it as an advantage. However, because the fat gets absorbed after the surgery, this must be taken into account as the surgery is performed. Also, the surgery results must last long. Fat injection results can differ depending on the surgeon's sincerity, passion, and skill. During fat injection, fat is removed from other parts of the body and added to parts that need it. In addition, it is good to use IV sedation for anesthesia. This is because the area is large. Also, for a safe procedure, a patient must fast at least 4 hours before the surgery. Furthermore, facilities must be prepared to check the patient's health during the surgery. Fundamentally, a blood pressure gauge, electrocardiogram, and equipment to measure the amount of oxygen in the blood must be prepared. This is what it looks like to prepare fat injection. First of all, after designs are made and pictures are taken, images are transferred to the computer monitor. Therefore, the preoperative appearance can be used for reference at any time. Also, the areas undergoing fat injection and liposuction are made ready. A simple apparatus is prepared. Although fat injection looks like a simple procedure, it requires a lot of help from the staff surrounding the area. The areas receiving fat injection are marked with ink beforehand. Areas that receive it most are the forehead, upper eyelid, below the eye, lips, temple, cheeks, and chin. Usually, fat from the stomach and thighs undergo liposuction. The best fat is from the area that gets fat easily when gaining weight and that doesn't lose fat easily when losing weight. Because as a person ages, they gain fat on their abdomen and lose fat on their thighs, our hospital tries to remove fat from the stomach or waist as a principle. To perform liposuction, anesthesia must be given beforehand. The anesthetic is mixed with saline solution and is injected in the body using a special tube. This method is the same when performing liposuction. The areas receiving liposuction and fat injection are prepared like the picture. This current picture shows the cannula used for liposuction. For this person, fat is extracted from the abdomen. 20 minutes after the abdomen receives anesthesia, pure and healthy fat without any blood can be injected. When the extracted fat is raised, the heavier liquid settles to the bottom and the fat floats on top. The fat on the left was just removed. However, if this fat is raised, like in the right picture, the liquid will settle down to the bottom as the fat amount decreases. The amount doesn't actually decrease, the fat amount becomes more concentrated. After raising the extracted fat for about 20 minutes, it is centrifuged to get pure fat. Like in the lower right picture, more refined and concentrated fat can be obtained. As shown in the picture, after centrifugation, oil from destroyed fat cells float on top. The bottom is composed of water, saline solution, and blood components. The level with pure fat and the level with stem cells are used for fat injection. The separated fat is injected in the face or other areas through a small syringe. Instead of using a sharp needle, a small and blunt cannula is used so that surrounding blood vessels or nerves do not get damaged and the procedure proceeds safely. Right now, I will talk about fat injection results. This person has a flat forehead. Designs were made on her flat forehead. After fat injection, her sunken forehead was filled with volume. This is the 45-degree angle view. Her sunken forehead now protrudes. This is the side view. This is another person who received fat injection. Although she had a sunken forehead, she now has a bulging forehead. However, a forehead that bulges too much should be avoided because it looks unnatural. In the picture, implants, filler, or too much fat injection will cause the forehead to bulge too much. This forehead is too unnatural, so if possible, it must be avoided. This picture shows when fat is lacking on the eyelids. If fat is lacking on the eyelids, the eyes can become easily tired. Also, as you can see, there will be multiple layers of double eyelids, and a double eyelid can look excessively high. As shown in the lower picture, after receiving fat injection on her eyelids, the shine in her eyes became clearer, her eyelids appear neater, and the eyes do not get as tired during the afternoon. Here's another person without fat on her eyelids. It has been a long time since she received fat injection. It has been about 10 years. She received forehead brow lift and fat injection. Receiving fat injection doesn't mean that fat will disappear quickly. 2 or in severe cases, 3 fat injections can be given. However, a well-performed fat injection can last a long time. Here's how she looks like in a 45-degree angle. Her eyes look so much clearer and lively. By looking at the whole face, a person can look younger with just fat injection on the eyelids. Here's a side view. Next is a case where the chin receives fat injection. Like pictured above, this person had a small chin. Pictured below, when the chin is augmented, it protrudes forward and becomes longer. At the same time, the drooping skin under the chin improves. Here is a close-up picture. You can see that the chin projection is lacking and that the chin is very short. Unbelievably, after the surgery, the results seem good. Here's another person who received fat injection on her chin. Although really hard to believe, this person received good results. During the first time, 8 cc of fat was injected. In her second, 7 cc, so altogether 15 cc of fat was injected. Her results are dramatically good. Here's a close-up of her before surgery and after surgery appearance. She received a nasal tip surgery at the same time. This person received fat injection in her cheeks. Like this person, if you do not have fat on your cheeks, your chin can look long. Therefore, after receiving nose surgery at the same time as chin fat injection, her chin looks relatively shorter. Here's how she looks before the surgery and after. Earlier, I mentioned that you can not only receive fat injection on your face, but on other parts of the body as well. This person received fat injection in her hands. Because of aging, her veins were more visible and her hands became rough. First, fat is injected in between the skin and the blood vessels. Here's how it looks like 1 week after the surgery. This is the right hand and the left hand. Here's the preoperative picture and a 3 months post-operative picture. Before, due to the skin, the blood vessels were visible. However, now many are hidden. Also, the skin elasticity increased. Here's the right hand. About 20 cc of fat was injected in each hand. Therefore, a total of 40 cc of fat is needed. For other areas in the face, likewise, using this amount leads to better results. Fat injection can be used in hips and breasts. This person removed fat from her upper and lower abdomen, waist, flank, and back, and injected it into her buttocks, hip, and breasts. Because voluminous buttocks creates a slimmer waist, it is important to consider fat injection in the buttocks when considering body surgery. Here's another person who received fat injection on her buttocks and hips. Fat was removed from her abdomen, waist, and injected in her hips and buttocks. Although fat injection is a safe procedure, there are possibilities of side effects. If too much fat is undissolved, it causes overcorrection. If too much fat is absorbed, it causes undercorrection. There can be fat necrosis. lipoma can be formed, and the surface can become uneven. There is a risk for injection. However, the scariest side effect is fat embolism. When fat is injected, fat can penetrate into the blood vessels. Then it can block blood vessels, leading to tissues or organs, causing fat necrosis. If this happens in an artery in the eye, the patient can go blind. If this occurs in the brain, a part of the brain can become disordered. In order to avoid these scary side effects, a blunt-ended tube must be used for injection. Also, a little bit of pressure must be used to push the fat in. By slightly taking back the syringe during injection, these dangers can nearly be avoided. Post-operative care is very simple for fat injection. The injected area should not be pressed or touched 2 weeks after the surgery. Also, showering is possible the day after the procedure, and light makeup is possible. As long as the injected area is not pressed and the face is not injured, the results should come out very well. Thank you.